Hi, today's topic is rheumatoid arthritis, and we are going to study it as a 10 marker question, and also there I'm going to tell you some 3 marker question and 5 marker question which can come from the topic. So, rheumatoid arthritis, very basic definition: chronic autoimmune disease primarily involving joints characterized by symmetric peripheral polyarthritis. Okay. Chronic autoimmune disease primarily involving joints and characterized by symmetric peripheral polyarthritis. Okay, now etiology. Main point to remember in etiology, HLA-DR4 and a 3 marker can come. What are the HLA-DR4 positive diseases? So it's a mnemonic. H Hashimoto, L lupus, A anemia. Which one? Pernicious anemia. D diabetes insipidus, and R rheumatoid arthritis. Now it is seen more in females, so ratio is 3:1, and also in monozygotic twins. If one twin have, then other twin might also have the chance. Okay, now pathogenesis. Learning pathogenesis is completely not necessary, but if you remember, good. So pathogenesis, first activated B cell, if because it's an autoimmune disease. In if B cells get activated, then plasma cells get stimulated. Plasma cells form autoantibodies. Autoantibodies with antigen form immune complex, which causes vasculitis. So one of the clinical features, vasculitis. Then activated T cell will release TNF alpha, which will go to synovial fibroblast. In synovial fibroblast, there will be cartilage breakdown, prostaglandin formation, so pain, nitrous oxide formation, so vasodilation. Then osteoclast precursor will get activated. Macrophage will form, and this macrophage will release acute phase protein, which are CRP and ESR. So CRP and ESR, that's why it is increased in rheumatoid arthritis. Now clinical features. Now there are two types of clinical features here: articular and extra-articular. First, we'll study extra-articular because extra-articular features will come as a 5 marker question. That's why I have put so many points. The mnemonic is claw of speedboat, C carditis, L low grade fever, A anemia, W weight loss, O nothing, F Felty syndrome. Now Felty syndrome is a 3 mark question. Felty syndrome contains rheumatoid arthritis, neutropenia, splenomegaly, S scleritis, P pleural effusion, episcleritis, eosinophilia, digital arthritis, bronchiolitis, osteoporosis, anorexia, and tenosynovitis. Now here, remember pleural effusion. This pleural effusion is an exudative type. Okay. Now some of these features like pleural effusion you can see in X-ray. So remember that. That's why X-ray can be important here in investigations. Now articular features. There will be early morning stiffness of hand joints. Which hand joints? Proximal interphalangeal joints, metacarpophalangeal joints, wrist joints, but not distal interphalangeal joints. Okay. So what it will all cause? It will all cause complaints of difficulty in getting ready before work. Okay. Now deformities. This is a 3 marker question. Three swan neck, button ear, and mallet finger. Please see photos of these deformities. Button ear will look like this. Swan neck will look like this. So it's a like there's a difference. Okay, so that's why please see the photos. Then investigations. First we'll do blood test. What it will show? ESR and CRP will increase. Okay. Rheumatoid arthritis factor (RA) factor will be positive. So this is a screening test, but it won't diagnose the disease. Okay. What is the diagnostic test? Anti-CCP antibody. Anti-CCP antibody. Then MRI can detect early bone erosions. X-ray can detect in late stages. Okay. So now treatment protocol. If there is a newly diagnosed rheumatoid arthritis, now what we suggest is we start him on an aggressive treatment, which is methotrexate. We will start, and over 12 weeks of course, we will increase the dose of methotrexate. And prednisolone also will start to reduce the inflammation, but the dose of prednisolone will decrease over 12 weeks. So there is something known as DAS28. What is DAS28? It means disease activity score. Okay, DAS 28 score. If it is less than 2.6, then okay, the disease prognosis is good. So continue methotrexate. If it is more than 2.6, then prognosis is not good. So start sulfasalazine and hydrochloroquine, which we call as triple therapy. If again DAS after 12 weeks, again after 12 weeks, if DAS score is less than 2.6, then continue triple therapy. If it is between 2.6 to 5.1, then change DMRDs or add prednisolone. But if it is more than 5.1, then add biologic DMRDs. Now we need to study about anti-rheumatoid drug because it's a 5-marker question. Okay, so DMRDs, disease modifying anti-rheumatoid drugs. Okay, disease modifying activity anti-rheumatoid drugs. So some are non-biological, some are biological. What are non-biological? First one, most important, methotrexate, which is an immunosuppressant. Then hydrochloroquine, sulfasalazine, and leflunomide. Here, when we talk about change DMRD, that means we can add leflunomide. We can add leflunomide plus methotrexate, and we will remove these two. The sulfasalazine and hydrochloroquine we will change. But then also it doesn't work. Then we will add biologic. So what is biologic? Biological DMRDs, there are two types, TNF alpha inhibitor and IL-1 antagonist. Two examples, etanercept and adalizumab. And IL-1 antagonist, anakinra. Now adjuvant drug, prednisolone or any kind of glucocorticoids. Okay. So how the question will come? So in question it can come very like a very long question can come like a female. Okay. 45-year-old female who says that she is having early morning stiffness of fingers. Early stiffness, early morning stiffness of fingers. So that's your articular feature. She can also say that she have low grade fever and she's having weight loss and anorexia. Okay. She also might be anemic. Okay. Okay. Now we did ESR. ESR is high. So we will think of, okay, some autoimmune disease is there. Then we will do RA factor. RA factor come positive. But RA factor is a screening test. So what we will do? We will do anti-CCP antibody. So anti-CCP antibody, once it's confirmed, then it's a rheumatoid arthritis. Then in exam they can ask what are the types of anti-rheumatoid drug, which I already told. Then what is the treatment protocol? Investigations they won't ask as a 5-marker, 3-marker. Then they can ask the most important question is definitely extra-articular features of rheumatoid arthritis. So please remember that. Okay, this was the topic, rheumatoid arthritis. Thank you for watching the video. Please subscribe if you like the videos. Thank you.